Good evening, everyone. We have about 3 minutes before our Kahoot challenge starts, and tonight it will be the ACLS review. Hi, Marilyn. Go to kahoot.it and enter the PIN 9288932, and we'll get started in a few moments. All right, and if you're just tuning in, we're going to get started at 10 p.m. The time is now 9:58 p.m. And you want to go to kahoot.it and then enter the PIN 9288932. Hi, Anna. Thank you for joining. Hi, Jonathan. Thank you for joining. Hey, Amita. There are 28 viewers. There's only 2 people brave enough to actually participate in the challenge. Will there be a third? Hi, GH17. Hi, Jane. Hi, Diet. 32 people viewing. Hi, Adelise. Fortune. All right, so I want you to go to kahoot.it and then enter the PIN 9288932. Hi, Paula. Wow, Jonathan and Anna. It looks like you two are the only ones playing. Let's see. Hi, Kim Soo. All right, question number 1. Name the ECG. We have 1 answer. We have 2 answers. 3 answers. Anyone else? Reveal the answer in 1 second. If you said SVT or supraventricular tachycardia, you are correct. Let's see who chose the correct response. Nika, great job. Your patient has a BP of 80/40 and this rhythm. What's the treatment? Adenosine, synchronized cardioversion, amiodarone, or defibrillation? We have 1 answer. Yes, synchronized cardioversion, because this patient is symptomatic. The systolic blood pressure is less than 90. So we're not going to try to give meds. We're going to go ahead and use the energy. Hey, LaTanya, great job. Question number 3, name the ECG. Ooh, that's not good. Is it SVT, polymorphic VT, VF, or monomorphic VT? We'll be revealing the answer in 6 seconds. And it's not too late to join the Kahoot challenge. Yes, great job. Monomorphic VT was correct. Hi, Bob, Iman, Anna, Latanya, Nika is still in the lead. Let's go to the next one. Your patient has no pulse and the rhythm below. Which of the below is the highest treatment priority? No pulse. We got one answer, two answers. If you said defibrillation, you are correct. Yes. So, of course, high quality CPR is in progress, but we need to shock them in order to treat that lethal arrhythmia. Hey, Bob Davis. All right. Jonathan's making his way up also. Name the ECG. Is it complete heart block, second degree AV block type 2, second degree AV block type 1, or sinus bradycardia? Great job. That was a complete heart block. The P's were doing their own dance and the QRSs were doing their own dance. However, none of the complexes were dancing together. There were no drop beats. It wasn't a wider drop, winky block. So that was a complete heart block. Who got Anna, Latanya, I see you on your way up. Let's see, number 6. If the patient is hypotensive, what treatment is most likely to be effective? All right, so a person with a third degree heart block or a complete heart block, they're hypotensive. Is it amiodarone, transcutaneous pacing, adenosine, or atropine? Oh, I couldn't trick any of you. Oh, hold up. No one got this one right. He was symptomatic, hypotensive. So you all, he need to be paced. The atropine isn't going to work with the complete heart block, and they're symptomatic. Let's go ahead and pace them. So the correct response was transcutaneous pacing. Number 7. Ew, is that SVT? Sinus tachycardia? Atrial fibrillation with RVR, or atrial flutter? And don't forget, tonight's winner receives $15. It was, yes, atrial fibrillation. So 2 people got it right. It wasn't atrial flutter. There weren't any flutter waves, and it wasn't sinus because that baseline was all wavy. It was kind of quivering, so it wasn't sinus tachycardia. Hey, Latanya, we see you at the top. Let's go, team. Number 8. Which of the below information is most important in deciding how to treat your patient with this rhythm? All right, so this is our patient who has atrial fibrillation. What is important? History of hypertension, allergy to ACE inhibitors, history of diabetes, or taking Eliquis, which is an anticoagulant. Which is going to be important if someone has atrial fibrillation? Taking that blood thinner, because whenever the heart is quivering, when it's just shaking like that, your patient's going to be at risk of developing blood clots. So they may be on Plavix or Eliquis, but that would be an important thing for you to consider. All right, next one. Number 9. This one's going to be easy. Name the ECG. Is it SVT, sinus tach, atrial fibrillation, or normal sinus rhythm? My fingers are crossed. Yeah, this one was sinus tachy. That's okay. Latanya's still on the lead. We got Bob Davis, we got Ayman, we got Anna, we got Nika. Fingers crossed, your treatment of this patient should be focused on what? So a patient with SVT, do you want to focus on rate control, the underlying cause, the management of hypertension, or maximizing the HCA HPS score? Yes, the underlying cause, because SVT could be caused by pain, dehydration, medications, drugs, illegal drugs that would be. So you want to treat the underlying cause, and by doing that, that would help control the rate. Great job, Anna. Which of the below is the most important diagnostic test to perform on a patient with hemiparesis? Half of their body is weak on one side. What test do you perform? Is it a 12 lead, a blood culture, a basic metabolic panel, or a non contrast head CT or CAT scan? Yes, because if someone has hemiparesis, that could be the sign that your patient's having a stroke. So we have to do a non contrast head CT. Welcome to the top, Bob. Number 12, how long do we have to get a CT on a patient who comes in with signs and symptoms of a CVA? So, door to CAT scan, is it 10 minutes, 25 minutes, 45 minutes, or 90 minutes? I know you want it to be 10 minutes, but hospitals, we're not that good. So it's not 10 minutes. You have less than 25 minutes to get that CAT scan done. Welcome back, Latanya. Number 13, which single action by EMS, that's your paramedics, is most likely to decrease time to treatment for a stroke patient? Is it starting the IV, drawing labs, getting a 12 lead, or call in a pre arrival notification to the hospital? Think about a code stroke. Yes. So I need EMS. I need those first responders to call the hospital because we just said we only had 25 minutes to get that CT scan done. So if EMS notifies the hospital, we're going to have a code team there waiting for that patient so we can start the IVs and get them to the departments they need to be in for further testing and evaluation. Latanya, Bob, Ayman, Anna, Jonathan, let's go. Number 14. What temperature should we cool a post cardiac arrest patient to in order to induce therapeutic hypothermia? 0 degrees Celsius, 25 degrees Celsius, 32 to 36 degrees Celsius, or 30 degrees Celsius? Targeted temperature management or therapeutic hypothermia. Yes, it is 32 to 36 degrees Celsius, and three of you all answered that correctly. Oh, Latanya, you're on fire. Number 15, how long should we cool a patient post cardiac arrest? Is it 12 hours, 48 hours, 16 hours, or at least 24 hours? We don't want that brain working too hard, so we have to cool them down. For how long? Yes, at least 24 hours. Look, I am so proud of you. I am so proud of you all for hanging in there. And these are some tough ACLS review questions, but it just means that if you're not already in the field to where you'd be leading a code or assisting with a code, you're one step closer. We are almost done with this challenge, everybody. And we have Latanya, Bob, Anna, Iman, Jonathan. Let's go. Number 16. Which of the following below is the only drug given prehospitally, which is a word, shown to improve outcomes in patients with an AMI or an acute myocardial infarction? What medicine do we give before the person gets to the hospital? Is it aspirin, oxygen, morphine, or nitroglycerin? Which one improves the outcome? Yes, it is aspirin because aspirin thins the blood. Usually, we don't have morphine just laying around before a person gets to the hospital, and we don't have nitroglycerin unless it was already pre-ordered for that patient. So whenever they're home, if they can take an aspirin when they start having the chest pain, that's going to thin the blood, and that should help to improve some of their cardiac concerns until they can get to the hospital. All right, Latanya at 5,077. Our next one, number 17. How long do we have to get a 12 lead ECG on a patient presenting with signs and symptoms of a myocardial infarction or a heart attack? Do you have 2 minutes to get a 12 lead, 10 minutes, 5 minutes, or 30 minutes? Let's see, it was 25 minutes for a CAT scan. And I think that a 12 lead is easier to get than a CAT scan. If you chose 10 minutes, you are correct. Yes, get them in, get that IV, and get that 12 lead done. All right, Anna, keep rising to the top. Next. What is the door to balloon time goal for patients needing percutaneous coronary intervention, aka a stent? They need a stent. How long do we have to get them to the cath lab? 20 minutes, 30 minutes, 90 minutes, or 180 minutes? Patient has a heart attack. They have a blockage. If you chose 90 minutes, you are correct. So yes, 90 minutes from door to balloon. Angioplasty, here we come. All right, Jonathan's coming up. He's climbing up on the board. Number 19, if the patient's 12 lead does not show ST segment elevation in 2 or more leads, they are not having an MI. Is that true or false? So ST elevation in 2 or more leads, if that is not present, could your patient still be having a heart attack? True or false? Does the EKG always show everything? Great job, team. They could still be having a heart attack even if the 12 lead doesn't show it yet, which is why we do other diagnostic tests, including those cardiac enzymes. All right, let's go to the next one, number 20. Which of the below would you do first for a patient in cardiac arrest? So the heart has stopped. What do you do first? Start chest compressions, defibrillate, apply electrodes, or get an IV access? First thing you do, think BLS. Yes, we're going to start those chest compressions. We need blood flowing. And then after the chest compressions, we can defibrillate. And one of the last things we want to do is worry about the IV access. We have to have someone doing high quality chest compressions. If we just have someone pushing meds in the IV and the chest compressions are not appropriate, the medicines aren't going to get to the heart. So high quality CPR or chest compressions would be your priority. Number 21, which of the below drugs probably won't work with a tibial IO or intraosseous device? So if you put an IO device in the leg, which of these medicines probably won't work? Adenosine, epinephrine, or amiodarone? Which one has a short half-life? Ew. It was adenosine. So adenosine, you have to have it in more like an antecubital area, and you want to push it fast, followed by a fast, rapid flush. So if you use an intraosseous device and you push adenosine into the leg, into the bone, it's probably going to not be effective by the time it reaches the heart. So adenosine, think left antecubital, push it fast, followed by a fast flush. You cannot use that in the tibial area. Number 22, epinephrine is used in all of the following cardiac arrest cardiac arrhythmias except. So when you use epi, is it for VFib, asymptomatic tachycardia, asystole, or pulseless VT? You want to use it in all of the cardiac arrhythmias except. If you chose asymptomatic tachycardia, you are correct because epi would not be given to someone who's not having symptoms. So ventricular fibrillation, that could be a cardiac arrest rhythm. Asystole and PEA are cardiac arrest rhythms. And then pulseless ventricular tachycardia is also a cardiac arrest rhythm. So the one that would be a perfusing rhythm would be asymptomatic tachycardia. And please don't give them epi because you're going to make their heart rates go up even higher. All right, Bob, I see you coming up. Let's see. Number 23, amiodarone is used to treat which cardiac arrest rhythms? When do we give amiodarone? For asystole, pulseless electrical activity, polymorphic ventricular tachycardia with a pulse, or VFib and pulseless VTAC? Oh, yes. Fingers crossed. Did everyone get this one? It is VFib and pulseless VTAC, so amiodarone. Whenever someone's in cardiac arrest and they have VFib and or pulseless VTAC, you give epi first, and then on the second cycle, you give your amiodarone. Third cycle, you go back to epi, and fourth cycle, you go back to amiodarone. So epi, epi, and amio, but only for VFib and pulseless VTAC. Which drug can be used interchangeably with amiodarone in cardiac arrest? Which drug treats rhythm issues? Which is an antiarrhythmic? It is lidocaine. Yes. Ventricular irritability, you can use lidocaine. All right. Bob is catching up to Latanya. Let's see the next one. How often do we give epi in cardiac arrest? Is it every minute, every 2 to 3 minutes, every 3 to 5 minutes, or every 5 to 6 minutes? The correct answer is every 3 to 5 minutes. So a good pretty much every other cycle, so about every 4 minutes. That is the American Heart Association's recommendation, which is why we go from epi to amio back to epi. So 4 minutes is the sweet spot. All right, Anna, I see you rising to the top. Number 26, a patient with an ETCO2, end-tidal CO2 value of 0 probably has the ET tube in the esophagus, metabolic acidosis, poor quality CPR happening on them, or respiratory alkalosis. End-tidal CO2 of 0. You all, their tube is not placed properly. The ET tube is in the esophagus. I need you to pull that tube back, reposition it, and check it all over again. You should not have an ETCO2 of 0. So the correct one was the one in red. Okay, reposition that tube. 27. An abrupt rise in end-tidal CO2 on a patient in cardiac arrest indicates degradation of the rhythm into a systole, ROSC, poor quality chest compressions, or hyperkalemia. An abrupt rise in end-tidal CO2. If you chose ROSC, return of spontaneous circulation, you're absolutely correct. So if those numbers spike up, that means you've done a great job, and hopefully your patient has achieved ROSC and is also breathing. So yes, they have a pulse, but you want to do that second check, your BLS survey. Do they have a breathing? Are they also breathing? And if not, you may want to intubate them. So here we go. Who got that one right? It was Iman. Number 28, a capnography value of less than 10 with a persistent waveform indicates high quality CPR, ROSC, low quality CPR, a misplaced endotracheal tube. Yes. So you want to tell that compressor to compress deeper, compress faster. But if the capnography value is less than 10, that means that the CPR is of low quality. I'm doing my nurse dance over here. Let's see, we have a few more questions. Question number 29. Ooh, heart rate 140, BP 110 over 74, respiratory rate 18, temperature is normal, O2 sats normal. What is your intervention? Heart rate's 140 and all the other vital signs are normal. What is your intervention? I know this one's hard. Yes, you all don't bother the doctor just yet. You don't want to be given adenosine, performing synchronized cardioversion. You don't want to do nothing. You want to seek expert consultation and continue to monitor your patient. Because whenever someone has an elevated heart rate, again, it could be because of pain, it could be because of infection. There are so many reasons that if it's just the heart rate that's elevated, you can call the doctor and you just watch them and keep watching their vital signs. Remember, for the American Heart Association purposes, anytime the systolic blood pressure drops below 90, we consider that person symptomatic. But right now, your patient's doing fine. Just keep monitoring them. All right, Latanya. The patient is unresponsive and does not have a pulse. Ooh. Synchronized cardioversion, defibrillation, intubation, or amiodarone. This is polymorphic ventricular tachycardia. Yes, you want to defibrillate. This is pulseless VT. Latanya, 3 in a row. You're back in the game. And this is an easy one. This is the end of our Kahoot. Latanya, you are the winner. So, do you want me to create a PALS game, a BLS game, a game for EKGs and rhythm analysis? How can I be of assistance to you all? And thank you for joining our Kahoots tonight. All right, so ECG, I love it. And someone said, nope, this game was not beneficial. I love you anyway. All right, so let's see. Anna came in third place. Congratulations. Bob Davis came in second. And number one, Latanya. All right, and so Latanya, just make sure, and Iman and Jonathan, you all are runners up. So Latanya, make sure you reach out to me at admin@fltraining.com and make sure you screenshot this so that I can see your prizes. And then Bob Davis and Anna, just thank you for participating, everybody. And I hope that you have a great evening and I wish you much success. And this is Nurse Eunice, and I am signing off. Thank you for participating in our challenge. Good night, everybody.